What's up, Pena fam?
What's poppin', Pena fam? What's poppin'?
How are you guys doing today? I hope you all are having an amazing day. I know this video is kind of random, but I will explain everything in this video. Long story short, we are on the way to Beverly Hills right now to go meet up with a surgeon, Dr. Swiston. He is going to be doing my explant surgery, which is a full capsulectomy, I believe that's how you say. Basically, he is going to be removing my breast implants and the capsule surrounding them. I already had a FaceTime consultation with him due to like everything going on. We just did it over FaceTime, so that was cool. And then right now we're going to do my pre-op appointment. He's going to just check me out, talk to us a little bit, explain what's gonna go down, and I'm gonna take you guys inside there with me so that you guys can meet him too. We are about 30 minutes away right now, so we'll catch you guys when we get there. We are in the office.
Just changed.
And just changed into my lovely
Sick new blouse.
OOTD. And he's gonna check out my chest.
Your tatas?
My TTs.
Your
My
TT
toes.
tatas?
Yeah.
Look at this
Look
view.
at this view. It's so cute. This office is so beautiful too.
I know, it's super nice.
So,
Yeah.
we covered a lot, so I wondered if you have any questions for me at this point. Just kind of going over my notes that we...
I mean, not too many questions. A little nervous for going under and everything like that, but I think as I get older, I just get more nervous about those things in surgery in general.
Yeah, you mentioned anxiety and palpitations and things like that, and then I talked to you about maybe getting in touch with a primary care doctor. Has that ever happened?
Yeah, so I did. She wanted to do like an over the phone call, but then I got my blood work done.
Okay, so your incisions are already in the fold, right?
Yes,
Okay.
under, yeah.
Yeah, so we would basically, what I would do is just extend that. If we're doing an en-bloc capsulectomy, then the incision has to be long enough for the actual implant and the capsule to come out through it. But the idea will be to hide them in the crease so that even out of clothes will be kind of hard to find, just because you're not getting a lift or a fat transfer at the same time. I know you opted against that. You just want them out, and that's very reasonable because that's the least trauma that we can do.
Okay, cool.
And the cosmetic result is probably going to be okay. There's a wide range of what normal is for a cosmetic result. So if you're happy with that, and that's fine, and that's sort of the least amount of scars that we would put on your breast in order to get the job done.
And how on average, how long does it take for the whole surgery to be done?
For just the explantation, it's usually about 2 hours.
Okay.
And then a little bit of recovery time afterwards and stuff. So.
And that's with the capsule removal, right? That takes longer than just regular without removing the capsule?
If you just not remove the capsule and remove the implant only, it takes about 5 minutes.
So it's definitely a
and this is
more
exactly why
surgery.
It's easy to cut corners.
Right.
You know what I mean?
That makes total sense.
When I train, there's some people that don't necessarily think that the capsule needs to be removed, and I disagree with that. And and it's definitely stays in there forever. I've gone in with to surgery with other breasts that had also already had the capsule. I mean the implant removed, but the capsule was left behind, and 3 years later the capsule's still there.
Yeah.
I mean it's shrunk down and scarred down and stuff, but it's definitely there. It doesn't melt away. And then again, it's just a potential space that's basically a circular scar that sometimes can act, or a spherical scar, so that can act like a cyst. That can act like anything out of the ordinary, and it can definitely cause asymmetry or other issues, tethering and things like that.
So it's better to get the whole thing
right,
out
so
of there.
just physiologically, it's better to get the whole thing out of there. And then if we're considering, the entire found on a breast implant illness, how does that impact things? There's a lot of things we don't know about that particular aspect of things. So, there's a theory that's that some of that silicone gets trapped in the capsule, and that's why you want to get the capsule removed. I'm not sure if that's true. I haven't really seen a lot of evidence for that. But I know that is something that is of a concern. I think the body does have a way of clearing its own toxicity in silicone. And there's studies where people had ruptured implants, like really, really old implants, where the silicone was not form stable the way it is now, but it used to leak out of the body, I mean of the capsule even, and then it would be found in the lymph nodes. Just like cancer, you know, silicone would be spreading into the lymph nodes, and if you get an ultrasound, you can actually tell, or an MRI, you can tell that there's silicone in the lymph nodes. And the good news was that once those implants were removed and the capsules were removed, even if you leave the lymph nodes there, if you do serial imaging, some of that silicone actually reabsorbs over time. So once that big load is gone, the stimulus is gone, the body does have a way of clearing.
Trying to clear it up.
Yeah, clearing things over time, but it takes a while.
Good morning, guys. It is 4:30 a.m. I'm about to head over to my surgery. I could not eat anything after midnight last night or drink anything, but I do have to take this, which is gabapentin with just a sip of water. So I'm gonna do that.
You take it?
It's weird not taking like a lot of water. I have my open shirt, that's like my button-up shirt, because I won't be able to pull anything over my head. And then I'm gonna bring a pillow so that I can be comfy in the car. Should I bring the bigger one?
It's up to you, mommy.
Bye, mama girl. I know you're gonna miss us. I love you so much. You'll be fine. No, I'm about to feed her right now. She has her dry food, but I'm gonna put her wet food out.
Oh, you're fancy.
And let me put some more.
Look, she runs. She's like, oh, heck yeah. She should be good, mama.
Okay, guys, we just got here. It is 5:46, so we are early, which is good. I'm not nervous. I have a lot of peace. I feel like God's giving me the peace I need to go into this. And it's so dumb because I was so nervous for like 2 weeks, and then now I'm here, and it's like, I'm here.
Well, I'd rather
what am I
be
gonna
like
do?
that than the opposite.
Yeah, that's true.
Dear Heavenly Father, we thank you for this day. May you please just forgive us of our sins. We pray that Amanda's surgery goes nothing but perfect. And we ask that the surgery goes very smooth and the recovery process goes very smooth and everything goes just as planned. And we ask you to watch over her, watch her from the top of her head to the bottom of her feet, and watch over the surgeons and everybody in there helping. We love you so much in the name of Jesus Christ.
Amen. We're just gonna chill here until we have to go in. I think they
Watch
open at
TikToks.
6:30. Watch some TikToks. So we'll catch you guys in a few.
Okay. Are you ready? Sick? You look so good. You ready to go? Got all the paperwork out of the way?
I'm ready. I just went to the bathroom because I had to go with the nerves. Just kidding.
Taking out the capsule on this patient, and you can see that it's coming out nicely unblocked. There is the capsule with the implant inside, and we're just very gently dissecting all that tissue around it. Again, capsule with the implant inside here, breast tissue up here. And we're gonna keep going, make sure we're like this all around. Thank you.
Okay, it's about 11:36 and she just got wheeled to the car and she's crying.
These are
Tears of joy.
Like, I just started crying. I wasn't crying in there at all. But just coming in the car and like realizing that I never have to worry about my implants anymore makes me so happy. I'm literally crying tears of joy. The first thing I noticed is that I can breathe so much better.
Good. I'm so glad.
Like, I can take a full breath. It's so weird.
Yeah.
I didn't know that.
Good.
That it was like, I don't know, because my...
You didn't
okay,
notice
guys,
it because you had them.
Yeah, but my implants were pretty small. I mean, they're a good size. So for my body, they're pretty good size. But I didn't think they would be that. Like, I didn't think it would be that a noticeable difference getting them out. Like,
but
breathing wise, yeah. Like, it's
good.
so. And I was just crying, kissing Chris, because I'm like, I'm not. The whole time when I woke up, I was talking so much to her. She was probably annoyed because I was just talking so much about everything. Probably because I'm just so excited.
Yeah.
And like waking up, I was excited to wake up. I literally fell asleep and then woke up with no implants. It's crazy.
Good. I'm glad everything went well.
There was no complications. Dr. Swisson, oh my gosh, thank you so much. Sorry, I still have like medicine in my mouth for the nausea. We have to come back tomorrow for the checkup.
Yes.
So we'll see him then. But he did record footage on his own.
Okay,
and he
cool.
said he's going to send it to me. I don't know what I'm going to put here on YouTube because it's like the capsules and the implants. Do you think I can
he said, he called me and he said right when you got out, he called me and he said that he'll see us tomorrow. He recorded some stuff and then he's going to clean up the capsules and then we'll be able to take those home also. So I know that we'll be able to see those.
And we're finished with the M-block explantation for Amanda Pena. And the capsules are super thin. They're actually drying out a little bit, but I just wanted to open them for her. The implants are still inside. The capsule is so thin that it did tear in a couple of places, but I'm confident we got the whole thing out. Right now, I just don't want to rupture the implant because I know she wants to keep it. So I'm just going to open this capsule. You can see it's paper thin. It's not even paper. It's even thinner than paper. It's totally see-through, which is what we expected based on our physical examination. But we're all around it. I'm just going to tear the rest so that I can salvage the implant without risking cutting it with these sharp scissors. But here's the capsule. Again, very, very thin, see-through capsule. This is where it was vaporized off of the rib. But confident the whole thing is out, and the capsule looks normal, a little dry as we expected. That was the left side, and then on the right side we'll do the same thing again without me damaging the implant. It's already dried. This is how thin it was. Within a space of less than an hour, it just kind of dried out like this. But I'm just gonna use this bluntly. Again, same thing. Normal looking capsule on the inside. That's the glistening part that you see here. Very, very thin. Kind of see-through throughout, but otherwise completely normal. And here are our implants. These are hard to read, high profile 290cc, Mentor 290 high profile. All right, thank you very much.
So that was good, but he did say that everything went very well. There was no complications, no surprises. Everything went just as planned, so that's good, thank God.
And I asked the anesthesiologist, I was like, was everything like normal? I was like, did I try to wake up or something? She's like, no, everything was really stable, everything was good, which is what I was praying for. And thank you guys for praying too, and my whole family.
Yes.
I'm so emotional because
That's okay, Mommy.
I'm happy. I'm so happy.
Good.
I'm relieved. Well, for any surgery, when you wake up, you're relieved. But I'm relieved because I know that I'm never going to have to worry about, like, these implants or getting another surgery or whatever. Like,
good. I'm glad. Well,
sorry, I'm talking a lot.
No, you're good. No, you're good, Mama. You ready to go home?
I'm ready to eat.
You're hungry?
Yeah.
You fat girl. Okay, let's go get some food.
When I woke up, I didn't throw up or anything, but just standing up, I got really dizzy. That's why she gave me this. What is it, Zofran or something?
I don't know. But we need to get you some food in you.
Show
you
my
okay?
chichis.
No, it's okay.
Show my cheeks.
No, I don't. Okay.
Okay, I have. No,
I want you to relax. I don't want you to do anything crazy.
I'm not, babe. I'm not
Okay.
gonna freaking rip it off.
Okay.
I'm just gonna show them the tubes.
Oh, you have tubes here.
Yeah, I have two things to catch the drainage. There's one.
You have one on the other side, and I see the tubes right here.
Yeah. And then I'm like spray tanned right
Dude, they
here.
tatted you.
Yeah, I'm tatted and spray tanned.
Sick.
So when you go in, you get free tattoos and free spray tan. It's a little orange, but I don't mind it.
Cool.
And then the drains. I'm gonna have the drains for how long?
About a week, I think.
Yeah, and I'm not on any pain meds right now.
Good. We're gonna get some food in you, and then we'll get you some pain meds if you need them.
Yes. Pain wise, I'm good. I'm not on any pain meds, but I am still probably numb from the shots that they probably did during surgery.
Yeah.
But the fact that I can breathe, like it ignores the pain.
You feel a physical difference already?
So much.
That's crazy.
So much that I can cry. I'm gonna cry
Good.
the whole car ride.
Good,
So
that's okay.
just ignore me.
All right, let's go get some food. Let's get
Okay.
some food in you, and let's get your booty home. I love you.
Love you. I'm so happy.
All right, we'll see you guys soon. Bye.
Oh, are you okay? You falling? Uh-oh. Stella fell, guys. Did you fall? Uh-oh. Good morning, guys. It is the next day after surgery, and I woke up feeling really sore. Hi. Chris made a note that, hi, she says, Chris mentioned like that's how it is, you know, with working out, you're always sore the next day, and it's true. The muscles of the on my chest have to literally reattach because I did get the implants under the muscle. She's literally playing on the phone. Who is that?
Yeah.
Hello? Hello, is Stella there? Hello? Oh, hey, girlfriend. Mommy got surgery.
No.
Yesterday, I took one pain med when I got home, and that was it. I wasn't on any pain medication for the rest of the day. So from like 2 to 9, I was good. But as long as I didn't really move. But today I woke up so sore. Chris had to like forklift me out of the bed because I couldn't like even use my abs to get up. But I just took the pain med so that we can go to my next day checkup with Dr. Swiston. So he's gonna check me, he's probably gonna look at them, and I'm gonna see them probably for the first time, and Chris will see them, so it'll be a good time. And he's just gonna check and make sure everything's good. I have been emptying my drains. That's how they look. And yeah, so today I'm more sore than yesterday, but I think that's pretty normal. It's not unbearable, but I don't want to move, you know what I mean? So anyway, so far so good. We're gonna go to my appointment, so let's go. Okay, so I want you guys to see my eyes because I feel like I noticed my eyes look like crystal clear. I don't know if the camera's picking it up, but before I had like yellow in the whites of my eyes, like a yellowish, grayish, brownish, like tinge, is that how you say it? And I feel like I don't see that right now, and I feel like they're really white, and my eyes look like almost like I'm wearing contacts. They look like really moist, if that makes sense. And then a huge difference that I also noticed is my skin. I have extremely dry skin, and that is a side effect of breast implant illness. Like, that is one of the symptoms. Dry skin, like in general, like all over your body, and especially your face. And do you see this oil? Like, do you see that? That never happens. I have not put anything on my face, like no moisturizers, nothing. And my face is literally just like so oily and glowy, and I freaking love it. So these are just things I'm picking up and wanted to share with you. It could be a coincidence, it could be because of surgery, like I don't know, after effects, but I don't know. I feel like it's not a coincidence at all. So I just wanted to share that.
Good with Daisy.
Yeah. Update, guys, I just threw up so much. So basically the pain medication that I was taking, well, I took one yesterday, I really didn't feel like much pain relief. I just felt kind of drowsy, so that's why I didn't take it the rest of the day. Well, today I took it so that I can go to this appointment in the car, so that just in case it's bumpy, you know. And I took a little bit more to see if it would actually help with the pain, because yesterday it really didn't. And it just, I was good for like what, like an hour in the car, and then all of a sudden, I mean, I was dizzy. Don't get me wrong, I was dizzy. But then all of a sudden, just out of nowhere, I just felt the need to throw up. Like, it didn't even warn me. It literally just like came up, and I was like, oh God. So I grabbed this Chick-fil-A bag and I just threw up so much. It was a lot. Poor Chris. I was like trying to keep it clean. Like, I just kept it in the bag. But it was a lot. So we just stopped at a gas station and threw it away. Ew, that's gross. On the outside, not on the inside. So now I have no pain meds in me. It was perfect timing though, because I have to take my antibiotic at 9, and I was about to take it. It's 9:15, so I'm glad I threw up before I had to take it, so I didn't waste an antibiotic, so that I'm able to finish them, you know. So I'm just chewing some gum. I'm about to take my antibiotic now with some water, and I'm good to go. I feel so much better, not on pain meds, and just like getting that out of me and like throwing up. So yeah, there's my little update. Okay guys, we're here. We're just waiting for Dr. Swiston to come out, and then he's gonna do whatever he's gonna do. I really don't know. I think just check like maybe the incisions, and we're gonna see him for the first time. Chris hasn't seen my boobs yet, and neither have I. Like, I peeked, but I didn't see the whole thing. They look really deflated, but I know the skin will get tighter and tighter as, you know, time goes by, so super excited about that.
So it sounds like you did great. Here are your implants. We kind of packed them up for you.
Thank you so much.
You're welcome.
My little souvenir. Oh,
Yeah.
These are heavy.
Some people want to burn them. Some people want to keep them forever.
I know, right?
Whatever you want to
I'll
do.
decide tonight. I'm just kidding.
Whatever
Wow,
you like
these are
to do.
so heavy.
Yeah,
I did not think that they would be that
It's a little
heavy.
bit of weight.
You see these?
Yeah.
Yeah, but it sounds
Don't
like
feel them.
Oh, dang.
They're really heavy compared to
Yeah.
what I thought. I thought for some reason
Crazy.
saline weren't as heavy.
no, they're the same. Very close to the same. It's silicone. But it looks like everything went well. So one thing I do is, I put a lot of numbing medication in the drains in that whole
Okay.
space, so that I kind of like it to be sitting around without the drains working for a while. Some people don't reset them until they get home, which is basically what you did.
Yeah.
Because that numbing medication is time to work and just kind
Oh,
of infiltrate through everything, and it's a long-lasting numbing medication, so that really gets you ahead of the pain curve.
Oh, gotcha.
And in addition to that, there's some numbing medication that I put exactly where the incision was and all that
Mhm.
stuff. So good. So it sounds like your pain is pretty well controlled.
Yeah, maybe because compared to getting them in,
Mhm.
that was way worse.
That's usually the case, because you put them under the muscle, and that volume expands the muscle, so there's a lot of
Yeah.
tension
Right.
that people don't really expect. The incision itself is not so bad.
Yeah.
This is sort of the opposite. We relieve the tension of the muscle,
Yes.
but there is a more extensive area of dissection.
Mm.
But most of the nerves live on the outside and close to the edge of the skin. There's not really many nerves on the inside, so you're going to feel a little
Okay.
sore.
Yeah.
Like you just did 1,000 push-ups last night, which was too
Right.
much. You
Yeah.
overdid it at the gym. But other than that, it's not that bad.
Yeah, it's not bad.
Okay. Well, good. I'm going to check everything in a second. But that's the most important thing. I would recommend that you do the ibuprofen and Tylenol, because at some
Okay.
point that stuff is going to sort of wear off. And I don't really want you to be limited by pain as far as moving around. I don't want you to do a lot of heavy exercises or
Right,
anything, but
yeah.
stretching,
Oh, okay.
range of motion stuff. Make sure your shoulder moves in every direction, all that stuff.
Okay.
That's important, just so that the scar doesn't freeze anything up. There's lots of theories about that. A lot of patients after the explant say, like, I feel so much better because they're out of my body.
Right.
Yeah, I don't know. It's very early.
Yeah.
I do know that you get steroids during the
Mhm.
surgery, because that is a great modality to help you with nausea. That's
Mm.
usually why anesthesiologists give you just a shot of steroids. It's a single dose.
Okay.
It's very safe, and it really helps with nausea, and it sounds like it worked, because you didn't
Yeah.
have that much nausea after you got
Yeah.
home. But that does tend to make people feel a little bit better,
Mhm.
okay, in the short term, for like 2 or 3 days.
Oh, okay.
So I always tell that to patients because
Yeah.
that could be it, you know. But that said, a lot of my breast implant illness patients actually said that no, this has lasted way beyond a couple of days. I'm just
Right.
feeling much more energetic. It's been a week, it's been 2 weeks. I see them at 2-week follow-up, 4-week follow-up, and
Right.
I just feel so much better.
Yeah, just overall.
Yeah, so we'll see.
Yeah.
Okay, but we'll see.
Definitely mentally happier
Good.
and physically it's not bad at all. So I'm like, I'm good.
Yeah. Well, you have a little bit of a recovery to do right now.
Yeah.
The drains are working. I'll teach you, just to make sure that you know exactly what to do with those. This is almost clear, which is awesome. This means basically there's no bleeding at all.
Okay.
Which is the reason you're actually here today. I like to check on all my patients the
Yeah,
next day
make
to make sure that there's no bleeding or no side effects. But this is exactly when you see it. It's a collapsed drain. That means it's working. It's suctioning, and there's a little clear fluid in there. Okay, so the fluid that you're making is being removed. The space between the breast and the chest wall, that is empty space because that's where the capsule was and the implant was. That empty space is now collapsed because of the negative pressure that we have. And that's going to allow that breast tissue to heal against your chest wall like the way we want it to. As opposed to, with a little suction. As opposed to, having a fluid collection there, which would be, that's called a seroma. It's not what you want. And eventually if you have a fluid collection there for a long enough time, your body will actually make another capsule around the fluid. So this is why this is so important, and a lot of patients before we do the surgery ask, do you use drains? Yes, I do, and this is why. Your incision is not that much bigger. It's probably about twice the size of what it was.
Oh, okay.
And it tends to shrink down a little bit once all the tissue shrinks down. So, I'm hopeful that it'll just kind of normalize. But we should just get you back to what you were before your augmentation, pretty much. Because like we talked about it, you're young, and your skin should shrink down significantly. Okay. And that'll take some time. Usually, a lot of it happens in the first couple of weeks, but it does happen. It does take place over a whole 6-month period.
Okay.
So you're not at the final result yet.
Okay.
Okay.
And how is it with the capsules? Were they like on my ribs or anything, or? How is that?
Yeah, that's always the case.
Yeah.
So it basically adheres to everything around it. So it was intimately adherent to the muscle on top, and it was adherent to the rib cage and the bone underneath. And sort of there's a lateral muscle that's called pectoralis minor that it was also involved with, and on the inside. So I have the video. I was gonna.
Oh yeah, love to see that.
We can
now
share
that I'm
those.
not going through it, I would love to see it. Okay, guys, it is Saturday. I finally put my hair up. I can reach over my head. I just finished filming like a couple TikToks to kind of share my story and in hopes that it helps you guys. I don't smell amazing. I haven't showered. It is Saturday, so I got my surgery on Tuesday, so it's been 4 full days. And no shower yet, but Chris is gonna help me shower right now, and I'll probably feel so good. I still have my tubes in. The output is doing really good. These are a couple hours. This is like a couple hours of fluid. So that is really good. I think after tomorrow I should be able to take the tubes out. I think we've kind of been a hot mess here. Ava has an ear infection because she was swimming in the pool and she got an ear infection. So we've been giving her drops, and Chris had to take her to the doctor during this recovery time. So I'm like, she had a fever for 2 days, and I'm like, I hate when my kids are sick. She's not sick, but you know what I mean? Like, not feeling good. So it's been kind of rough around here, but Chris is doing an amazing job of taking care of me, taking care of the girls, and taking care of himself. Thank you so much, babe. If you're watching this, I love you so much. I love you even more in sickness and health. You know what I mean? And you are here. You are the homie, and I love you so much. Mwah, I love you so much. Okay, so Chris is gonna help me shower. Like I said, I really didn't film too much yesterday or the day before because there's not much to update. I was really sore the next day. The next day was probably the most sore I was ever, if that makes sense. My energy is just really low. Obviously, I just had surgery. I'm trying to recover, so that's fine. I'm just thankful to God. I updated you guys a lot on my Instagram stories, so I'm trying not to repeat myself on here, but I just want to say I'm so thankful to God for this surgery. I'm so thankful for Dr. Swiston. Oh my gosh, he is the best surgeon ever. I will recommend him to everyone. Shout out to you. Thank you so much for doing this for me and just doing an amazing job at it and knowing what you're doing and just caring. And he's just like the most caring surgeon I've ever met. So thank God for him. And it was totally a God thing that I ran into his video, or not his video, but I was Shannon Rose. Thank God for Shannon Rose. I found her video of Explant. It was like posted 3 hours ago, and that was when I was trying to find a surgeon. So thank you so much, girl. Your story really helped me so much, and I hope that my story and our stories and everyone else who is sharing this awareness and bringing awareness to this topic helps people. So sorry about my vocabulary and English today. I am a little out of it. I have only been taking Tylenol. I actually wasn't taking anything because I felt fine, but I started taking Tylenol just so that I wouldn't get a fever, because I did get a little fever, and the Tylenol prevents that. So good to go on pain. That just shows that my pain levels have been fine. Other than soreness and other than discomfort where the tubes are, that's the most annoying part. Like, you guys got this. If you are about to get this surgery, Explant, capsulectomy, you got this. If I can do it, you can do it. The pain is not that bad. The recovery is a million times better than getting implants, and it is so worth it. I feel so relieved. I feel so happy. I am so excited to heal completely and just be the best mom I can be again for my girls, and the best wife I can be, and just be a little ball of energy again. I am starting to feel myself more and more each day. And yeah, it's been an amazing recovery. I cannot complain. I just, again, am thanking God so much that everything went smooth, and just continuing praying for this recovery. I also feel like God put this on my heart to share with you guys, just to let you know that you are beautiful the way you are. You do not need surgery to make you beautiful. And I wish somebody would have, I mean, people did tell me back then, but like, I didn't listen. But I could have saved myself a lot of trauma to my body, scars, and money if I would have just listened to those people who told me I was beautiful the way that I was. At the end of the day, your boobs are just stupid balls of fat. They are beautiful, but they are pointless, honestly. Not pointless, but you know what I mean. Like, we worry so much about them. As a teenager, all I wanted was boobs, and like, if I had boobs, I was set in life. And now looking back at it, I'm like, oh my gosh, I was so dumb for thinking that way. We are more than just boobs. We are way more than that. At the end of the day, I am a woman. No matter how big or small my boobs are, I am the most confident that I've ever been, just because I finally learned to love myself, and that is huge. So I'm gonna go shower. I'm not gonna show that because that's a little messy, but Chris is gonna help me, and then I will update you guys as soon as I can. Oh my goodness, I am out and I feel like a new woman. I wasn't able to scrub too much because I didn't want to be like doing too much in the shower. But I was able to wash my hair, and the whole time Chris was just holding my tubes. He was just holding these and then like standing outside the shower, and then I was able to wash like this. It was kind of weird just seeing these tubes just sticking out of me and just like, ew. But I was able to get through it, and I feel so much better now that I'm clean, or somewhat clean. I did the best job that I could do. So I'm just a little fashionista. Literally, could I be more stylish? These are the vibes of the day. Got my little purses right here and right here. I'm gonna obviously try to take it easy. I'm still gonna be working and stuff like that as soon as I can, but I'm going to definitely try to give my body a break for once and take it easy, because you guys know I'm always go, go, go. And as a mom, it's just, that's just what you do. You're just like that, you know? And then on top of it, I have like a full-on business that I try to run by myself, and it's just a lot for one person. So I'm really gonna try to give my body the grace that it deserves and take it easy and not just go as crazy as I usually do. And if you're wondering what I've been watching, I have been watching Dating Around. I watched a little bit of that. It was kind of weird. And then I watched some of Married at First Sight. I think I'm gonna watch that. And then, what else did I watch? I was watching Magnolia. I watched the whole season of Magnolia, or The Magnolias, or whatever it's called. Oh, this one, Sweet Magnolias. I watched that. That was really good, but it left me on such a cliffhanger on episode 10, which was the last episode of this season. And I don't know when they're going to be making more, so that kind of sucked. But yeah, I never watch Netflix. I never just chill and like watch TV or YouTube or anything. So this is my time to definitely do that. And other than that, I've just been praying and talking to you guys on Instagram, TikTok, etc. So check me out on there if you aren't already. I've been trying to be present with the kids too. Can't really play with them too much, but yesterday I was playing with Ava a little bit. Stella will just try to climb all over me, so I couldn't really play with her. Just been giving her kisses and then that's it. But yeah, Chris for the most part is with the girls like all day, so, and his sisters have been coming and helping, and then my parents too, so God bless their hearts. Okay, I just got confirmation from my surgeon saying that we can now remove my stitches and drains. So I am so excited because these guys are getting annoying. So I'm super excited to remove them. Chris is gonna help me take them out. He's gonna cut the stitch.
It's literally one
drains.
stitch and I'm over here excited.
He said if there's blood clots, it's okay. Take them out, should be good. I'm not gonna show you guys like too much because obviously can't show you my boobs, but I will like probably leave the audio so that you guys can enjoy that.
Ready?
Yeah.
Are you freaking being a Star Wars Jedi in here? See? No. Now you can pull it out.
Okay.
It's done. Trust me now?
Yeah.
Are you sure?
I've been trusting you, Beba, but
Okay.
it's nerve-wracking. You're taking a tube out of my body.
No, you're gonna pull it out. You want me to pull it out, or are you gonna pull it out? Whatever you're comfortable with, I'll do it. You want me to pull it?
Yeah, it's softly.
Okay, here, hold this.
Softly.
Okay.
Okay. Softly.
I got you. You feel that?
No. Oh, that feels so weird. It feels so wrong.
Does it hurt?
No, it just feels wrong.
It's coming out. You're
Oh
good?
gosh, it feels so wrong.
Okay, relax.
Go ahead.
You good? You need to sit down?
No. Go ahead. It just...
You're good, mommy.
Ooh.
Don't look. Look at me.
Babe, it feels weird
I
in
know.
my body.
I know,
Go
but
ahead,
look
just
at
go.
me.
It's gonna be done.
Yeah, it's out.
Okay. Oh, Lordy.
Well, that's it. Peace out.
What's up, guys? It is 1 week and 1 day from my
Postpartum.
explant surgery, post-surgery. And we just got here to my checkup, so we're gonna go inside and see how these guys are doing.
Then you're very petite
Right.
overall. So, you know, kind of like I alluded to in the text last night, is that, you know, there's people who are a little bit bigger that just have more tissue to absorb that fluid
Absorb it all.
into. And then, so the thinner you are, the harder it is to absorb it.
Okay.
Because if you think about it, it's just a fluid pocket and some skin that's
Yeah.
harder.
Okay.
But we'll see. Most of the time we don't need to do anything. If we do, it might just be kind of numbing you up a little bit and going through that area that's already has an incision in it, and you know, just kind of drying it out.
Okay, so because I am on the more petite side, there was some fluid collection, and he said it probably would go away, but since we were here, he wanted to just remove it. So he took a needle, numbed my breast, and then he took another needle, which was like a bigger needle, and then he went in and with a syringe and like took out the fluid. And I think he said there was like what, like 27
and 26
milliliters
yeah, I think so.
of fluid. So that's not too bad over a couple days it's been. But he was like, we might as well remove it since you're here. And then he just said to take it easy and not do too much so that more fluid doesn't, you know, accumulate. Is that how you say it? Accumulate. But yeah, it wasn't too bad. He numbed it, and that was like the only not pain, but like the only pinch that I felt. And then once he went in with the other needle, I didn't really feel it. I just kind of felt him pinching my actual like breast tissue, which isn't, you know, the most fun, but we got through it. We're good to go. And now I have no fluid in there, which is good. So as long as I just chill, it shouldn't be like, we shouldn't need to do it again. He did say that he wants to see me again in a week, so we're gonna come back here in a week and just make sure that like everything is good with that. But I'm so happy that that is done and I don't have to worry about it, and now I can just recover. I'm able to shower, and he said just let the steri strips fall off in the shower. He did remove some of them, but there is a little bit left, so that will just fall off in the shower, and then my incisions can just, you know, start healing by themselves, right? I haven't seen my scars yet. Have you seen them?
Yeah, they're barely noticeable. When you had your breast augmentation, your scar was very not noticeable.
Yeah.
So.
And it was under the fold, which this is going to be under the fold too, hopefully.
It's in the same exact spot.
Yeah, it's in the same exact spot. So and then also there's so with my chest, it's kind of like, I don't know if concave is the best word, but it kind of like indents a little bit and then it goes out, and that is totally normal, he said, and it's just like the swelling of the tissues and everything like that. So he said after a month that should smooth out. It already smoothed out a lot in 1 week, but he said after a month it should smooth out even more. And then when it comes to recovery, he said that about 4 to 6 weeks is when the inside heals, and then about 6 months is when it like completely heals, right?
Yeah. Sorry.
Or sorry, the swelling. About 6 months is when the swelling completely like should be good to go. But that is pretty much it. We are going to head home now and see the girls and just relax, or try to relax. What is today? I don't even know what today is. Wednesday? But I think with all this being said, this is probably going to be the end of this surgery, explant, capsulectomy vlog. I am so happy that you guys are here to watch it and care to watch it and interested. This video is obviously not, you know, normal in our channel. We don't always post about stuff like this, so this is more private, I would say, but I wanted you guys to get like a little glimpse of this part of our lives, because it is a big part of my life now, and I wanted you guys to be a part of it. And I also, the main reason I wanted to share my story is to help you guys, because there was a lot of women that helped me make this decision for myself, and I kind of wanted to be that person for you. If you're going through this, or if you're thinking about surgery or anything like that, just know you're beautiful the way you are, and God made you who you are, and you are beautiful. But sometimes we live and we learn. We got to learn the hard way sometimes, and that's where I'm at in life, but that's okay. I'm excited to just continue recovering and just be a healthier person. But that's it for this vlog. I know it was all over the place, but I hope you guys enjoyed, and we love you guys so much, and we will see you